We know that the thickened choroid has been implicated to be the cause of pachychoroid spectrum of diseases, although the exact pathogenesis behind that is not known. It is hypothesized that the resistance in the vortex vein caused by a thickened sclera might induce an upstream congestion of the choroidal vessels, thus increasing the choriocapillary permeability. To study this hypothesis, we need to find the thickness of the sclera at the level of equator and also quantify the congestion of the choroid. But the sclera at the equator is difficult to be imaged, and the anterior scleral thickness can be measured with the help of ASOCT, and the choroidal congestion can be quantified with the help of indices like choroidal vascularity index and choroidal vascular density. But the choroidal vascular index uses OCT to measure it and thus restricts the details only to the posterior pole. But the choroidal vascular density uses ICG images, and even 200-degree field of image can be covered with it. But there is a lacuna in the literature comparing the anterior scleral thickness with the choroidal vascular density and subfoveal choroidal thickness in eyes with CAC, PCV, and AMD. So we intend to find the same, and we excluded the eyes in which the sclera can be intrinsically abnormal, like in cases of uveitis, glaucoma, and in cases with collagen vascular diseases and patients who were pregnant and lactating women. So we did a pilot study including about 15 patients from the Retina Services of Advanced Eye Center PGI, and the anterior scleral thickness was measured from 12 by 12 mm raster scans of ASOCT, and the anterior scleral boundary was measured by the solid hyperreflectivity from underneath the rectus muscle, and the posterior scleral boundary was defined by the low reflectivity from the choroid, and we measured the scleral thickness as the distance between these two lines from about 6 mm from the scleral spur, and we decided that we should do at 6 mm because after that after 6 mm it is difficult to define the sclera in the superior and inferior quadrant because of the presence of artifact from the lid and the fornices, and in the nasal and the temporal quadrant after 6-7 mm the posterior scleral boundary becomes blurred because of lack of resolution. And the subfoveal choroidal thickness was measured with the help of SOCT, and the choroidal vascular density was measured with the help of ICG image, and as we see in the image we are able to see both the choroidal vessel and the retinal vessels, and to derive the choroidal vasculature we needed to subtract the retinal vessels of the angiography from the ICGA image, and we did that using image registration of MATLAB software, and this is the resultant image. This has got only the choroidal vessels, and this was converted into a black and white image using Burnsen's algorithm, and the resultant image had white and black pixels. The white pixels of the image depicted the choroidal vessels, and the black pixels depicted the choroidal stroma, and the black pixels are there within both the background and the image. So we had to subtract the background from the image, and we did that using a mask using image software, and the MATLAB software thus detected the pixels within the image, and the choroidal vascular density was derived from the formula y divided by the total number of black and white pixels within the region of interest per se into 100. And we measured the scleral thickness at 6 mm, compared it with the subfoveal choroidal thickness and the mean choroidal vascular density. Comparing the basic parameters like the visual acuity, axial length, and refractive error, there was not much of difference between the three groups, and the choroidal vascular density of the CAC in PCV group was comparable, and it was statistically thicker compared to the AMD group, and the subfoveal choroidal thickness of the CAC group was more compared to the rest of the two groups as depicted in the picture, and the mean anterior scleral thickness of the CAC group was more compared to the rest of the two groups, although it didn't reach statistical significance, and the anterior scleral thickness in the temporal quadrant of the CAC eyes was thicker compared to the rest of the two groups. So concluding our study, we found that the anterior scleral thickness of the and the subfoveal choroidal thickness of the eyes with eyes with CAC were thicker, and the choroidal vascular density of the CAC in PCV eyes were more than that of AMD. So we add to the literature that indeed a thickened sclera might be the cause as to why the choroid gets congested in the CAC eyes, but the sclera is determined by multiple factors. It is determined by axial length, refractive error, and even by genetic and epigenetic factors. So further studies need to be conducted as to why the sclera of the eyes with CAC gets thickened. Our strengths are that we did a prospective study and we developed a new algorithm, and we are in the way of making a graphic user interface, and with that we can derive at the choroidal vascular density automatically if we feed in the ICG and the FFA images, and there are no similar studies in the literature, but we have our limitations. This was a pilot study, so we included only a very small sample size, and we do not have any age or gender match control, and the scleral thickness measured was much anterior to the equator, and the measurement of anterior scleral thickness and the subfoveal choroidal thickness was done manually, as there was no automated software, and the study is a cross-sectional study, so we didn't measure the parameter changes associated with treatment or any other variations.
Dr. Nikitha, that was a nice presentation.
Thank you, ma'am.
I have one question for you. You said you measured the scleral spur, did the ASOCT 6 millimeters, but did you take any eyes with astigmatism? Was it significant in eyes with patients with astigmatism also?
We measured the
Myopes and
refractive error
hyperopes.
also, ma'am, and
Was the
most of my
p-value significant in
no, ma'am, it
myopes
was
and hyperopes with
no, ma'am,
astigmatism,
no,
high
ma'am.
astigmatism?
Our most of the eyes were in the axial length of range 20 to 23, and the refractive error was also in the range of -1 to 2, both in hyperopic and myopic sense. It was not.
Measured the vascular density with the use of that formula. Why
Yes,
didn't
ma'am.
you use OCTA? You are already have published so many papers of OCTA from PGI.
But the OCTA depicts only the choriocapillaries. In the eyes with CSE, pachychoroid spectrum of diseases, the pathology is more in the halar layer of vessels, and the halar layer of vessels cannot be seen in the OCTA, as it depicts only the choriocapillary layer.
There are machines which show the choroid
There are
layer
machines,
also.
but the details are restricted only to the posterior pole, maybe 6 and 9 scans. But the ICGA image shows a wider image, 200 wide field, ultra wide field image.